Lesson 31, Science 7. And today we have some interesting questions for discussion that I know will get our science talk going. So grab your pencil, your journal slip, and later you'll need the Google form link posted on Schoology. But before that, we've been working to analyze the genetic profile of a mother and a father. But did you know that this is an actual job? People who analyze and interpret genetic data for children and adults are known as genetic counselors. If you found this phenomenon interesting so far, I want you to know that there's a potential career path in store for you. And to tell you a bit more, I have 3 genetic counselors from the University of Michigan. They recently put out this video clip in honor of DNA Day that just happened in April. Here, let's watch.
Hello, my name is Colby Chase. I'm a genetic counselor at the University of Michigan. Genetic counselors are healthcare professionals who can help people and their families understand risks for health problems that can run in families, and also help people decide whether genetic testing is right for them. Every genetic counseling job can look a little bit different from the next, and I'm here with a couple of other genetic counselors who all went to school at the University of Michigan to tell you what is unique about our jobs. So I work both in the adult medical genetics and cancer genetics clinics here at the University of Michigan. We see many different rare conditions, and we get to learn new things about these conditions every day. We also often see adults who have been looking for answers to why they have medical problems since childhood, and we get to help try to solve some of these puzzles.
My name is Kelsey McBeady. I am a cancer genetic counselor. I work both with people who have cancer and as their families as well. Basically, I explain the process of genetic testing and I help people decide if it's right for them. Test results might be used to determine the best surgeries or chemotherapy for a cancer patient, or for someone without cancer, how frequently they might undergo routine cancer screenings like mammograms. I also help run a support group for people who test positive for a genetic risk factor to help them deal with the knowledge that they have a higher risk for cancer.
Hi, my name is Adeline Beal and I'm a pediatric genetic counselor at the University of Michigan. In addition to seeing children and young adults to discuss their genetic health, I also work in newborn screening. In the United States, every child is screened at birth for conditions that need early intervention and treatment, and each of these programs is run through each separate state's Department of Health and Human Services. Part of my job is to cover 2 of these conditions specifically for the state of Michigan. Whenever there's a child who screens positive for either X-linked adrenoleukodystrophy or for spinal muscular atrophy, I help coordinate next steps both with the family as well as with the pediatrician to ensure that the child receives the best necessary treatment moving forward.
There are so many more different types of genetic counseling jobs. There are genetic counselors who work with women who are pregnant or hoping to become pregnant, who work in laboratories to analyze genetic testing results, and even at insurance companies to make sure the right genetic test is being ordered. We hope this has been helpful and thank you for watching.
Okay, so you just heard from 3 genetic counselors. And there are many other genetic defects that genetic counselors screen for. You heard about a few in the video with certain types of cancers that have a familial or genetic component. And another disorder is sickle cell anemia. We had discussed that in a previous lesson, and genetic counselors can screen for that too. Today, I want you to do 2 things. First, go to the discussion board and respond to this question. Would you personally want to know if you had a specific genetic disorder? Why or why not? Then, use the link posted on Schoology to take a check for understanding. This is your Google form check for understanding. I really want you to take your time when you do this. Use your science journal and all your entries. Don't rush. Take your time before you submit. So that's it. 2 things. You're going to do your Google form check for understanding, and you're also going to go to that discussion board and respond to this question. And remember, when you're on the discussion board, you should be responding to a peer as well. Until tomorrow, keep thinking, keep learning, and we're ready for one big simulation.